So today we heard the news that the preferred bidder for social care in Bath, that's sort of the thing, services run by Serona at the moment, so community midwives, sort of speech and language therapy, that sort of thing. Over 200 services are, well, the preferred bidder is going to be Virgin Care. Now, why should we care about that? Well, you might remember that when these services were split off from the NHS by the Tories and the Lib Dems, everyone was reassured, oh, don't worry, it'll be run by a non-profit, nice, friendly Serona. It's not going to be privatised. It's just the same people, but with a different label. And some of us were warning, actually, that's what happens. This privatisation is made palatable to the public by having the first contract go to a nice non-profit or a charity or something similar. And then the big bad boys come in, like Virgin Care. So now community services in Bath, which personally I depend on because my daughter is autistic, and we have used the speech and language services quite heavily. We had we've used community. Everyone in Bath and Bath and NE Somerset will have used community services to some extent. And that's going to be run for a profit. Now, if the budget is the same and yet profits are being extracted, how's that work? Is everyone going to become suddenly more efficient? No, of course they're not. They're going to be more or less the same staff on the front line. So cuts have to happen. That's the only way that profits can be extracted. Now, it's tempting to say, well, Virgin Care have never actually made a profit in the UK, and that's true. But of course, who owns Virgin Care? It's trusts in the Virgin Islands who don't pay any tax. We all know how clever corporate accounts can make it look like something doesn't make a profit. Starbucks is a good example, when actually the profit is being made by some third party. Now, I'm not saying that's what Virgin do. I have no evidence that they are in any way, let's say, conning anyone or doing anything ethically questionable. But let's face it, how would a company that doesn't make a profit in the UK, why would they bid for more work? Of course somebody's making a profit somewhere. It's convenient that it's not declared, and it's convenient they don't pay any tax on it. So there's a big swathe of NHS being privatised. It hasn't happened yet. They're the preferred provider. You must talk to the council and the CCG, which is the part of the NHS that awards contracts in BaNES, so BaNES CCG, demand that they do not privatise these services. It doesn't really matter what Virgin say, because in the end, you either believe that the NHS should be run for people and not profits, or you don't. And I've worked in public sector procurement for a long time. What you get is these big private companies promising the earth, and actually they sell their services, or they bid for a way lower amount than actually the services costs. And once everything's underway, they go, oh, but now we can't do this, we need a bit more money. Or that thing we said we'd do, oh, we can't do that, there's no money. And because the thing they took over from has basically ceased to exist, the public sector has no choice but to just pay them the money and carry on as if that's fine. I'm very, very concerned that if Virgin take over here, as they have done in several other areas, then there would be very little way to get that work back into the public sector. Yeah, it'll be the same people at first, but they'll be cheapied off, and then the people on NHS contracts will eventually drift away. And what we'll end up with is a lower level of qualified staff who are being paid less. That is what happens in almost any privatisation like this. It will not be good for patient care. I can't quite believe the CCG, who are NHS staff, it is beyond comprehension how somebody who works for the NHS cannot see a problem with giving NHS work away to the private sector. It is ethically questionable. And I choose my words carefully, because a lot of very good people work for the NHS, of course they do. And they are, to some extent, compelled to these things. The government has, in its wisdom, decided that it wants to destroy the NHS. That's a given. What we're seeing is just sort of everything that happens, like these contracts being awarded to Virgin, is just another example of how that's, what were NHS services are being siphoned off to Virgin and, parcelled up into little bits that can be sold. The building that Serona sits in, which, is NHS property services, which is ready to be sold off. It's all ready to be sold off. And it's just happening, not exactly quietly, it's pretty blatant now. it should really, really disgust people that this is what's happened. And yet, the Tories and the Lib Dems who are responsible deny it's happening. To this day, they deny it's happening. Oh, that's not privatisation. They say, oh, it's contracted out services. You know, by their definition, you can't privatise a service, which is ridiculous. Of course you can, and that's what's happened. So resist this. I'll be talking to people in Sirona to see what I can do. I want to stir up as much trouble as possible within the law. We've got to fight to defend our NHS. It's a disgrace that elected officials in the council and people who work for the NHS, for the CCG, will allow this to happen. Yes, of course, there's pressure from the Department of Health, and to some extent they've got to, but there are ways around it. Joy, don't give up. Don't give up. We can beat this. We might not beat it soon, but we can beat it. We just got to keep the faith, and we'll get that NHS back.